Gervais.
You know what, guys, having knee pain is no joke. Your knees, of course, are pretty much the most important thing when you're trying to walk, right? My goodness gracious, as we get older, arthritis starts to set in, but it doesn't necessarily mean that it's something for old folks. And maybe there's something to do with the rain coming in, too. Ms. Hima Dalal, the founder of Vital Energy.
It was that simple, right?
Right.
But rain will alarm you if you already have some arthritis set in your knees.
Why is that? What is that? Is it pressure that comes in that really...
So the synovial fluid that gets collected and it doesn't move, it can be lymphedema, it can be any other problem from old injury, chronic pain, or it can be acute pain, because since the child starts putting the weight bearing on the knee, that's when he starts crawling. That's the first time they weight bear. But then, since then, somehow we are weight bearing. We can be just sitting for hours, but it's in a constrained position or very tight space, and you're very tall, or wrong body mechanics of standing or leaning
and you can
down,
pull, and anything can really hurt it.
And
what about weight, obesity? You know, I mean, obviously your knees, your joints, you're holding up all this.
Yeah, think about it. That anytime you step down or step up, or you're just stepping, and if you are having excess weight or your muscles are weak in your knee joint from any old injury or just not using the muscles correct way, then you are going to put the whole body weight on that knee joint. And the knee joint is made of there's one bone that's in your thigh, then there are two bones in your legs, and then there is a kneecap.
And that's the cartilage in the kneecap.
And then there's a meniscus and cartilage, and that cartilage is the thing that starts wearing down. And it has nothing to do with injury. It can be just the wrong body mechanics, or another body part is hurting and you start walking wrong and weight bearing wrong. You're going to wear down that cartilage, so the bone is going to start rubbing on the bone. Every time you take a step or you stand up, this is what is happening. And that's where the pain comes. So when the pain is there, you're not going to move. So the stiffness comes. And the best way to get your knee stronger is go to the physical therapist, find a HydroWorks pool which has an underwater treadmill, because the buoyancy of the water will take the gravitational force away from the joint. So you're going to exercise without putting any excess friction, and you get stronger.
I love it. Ms. Hima Dalal, I got to stop here. There's a whole lot. In fact, we're going to continue next time we see Hima with knees as well. More details at abccolumbia.com.